Assalamualaikum and hi everyone. We are from UiTM Perak, Tapah campus. We'll present about new normal of outbreak and spread of the novel coronavirus. This is our team infographic. We are Mohammad Ali Imran, Mohammad Danial, Mohammad Haziq, Ahmad Nazif, and Mohammad Aizuddin. Did you know what is this? This is COVID-19. What is COVID-19? COVID-19 stands for Coronavirus Disease of 2019. The first case traced back to a wet market in Wuhan, China. Affected 213 countries and territories. COVID-19 was declared a pandemic by WHO on 11 March 2020. The disease spread via close contact and small droplets produced by coughing or sneezing. Did you know COVID-19 can mutate known as D614G strains? Chinese researchers say that antibodies found in blood of individuals who have fought disease previously fail to stop D614G strains. Potential to increase the number spike proteins on the coronavirus and boost its ability to infect human cells. Symptoms of COVID-19: heart fever that exceeds 37.3 Celsius, dry cough that irritates and constant coughing without expelling any mucus, tiredness, the body feels completely tired and without energy to perform normal tasks, difficult breath, chest pain, and loss of speech or movement. People who are older than 60 years or who have health conditions like lung or heart disease, diabetes, or conditions that affect their immune system are in a high-risk group.
Step of prevention during pandemic COVID-19. Personal hygiene. What is personal hygiene? According to the healthline.com, personal hygiene is the way we care for our body. This practice also includes bathing, washing hands, brushing teeth, and more. During this pandemic COVID-19, personal hygiene is always suggested to public in order to prevent the spread of the virus. It because every day people are exposed with millions of outside germs and viruses. At this time, the most important personal hygiene is the hand washing or the sanitization of hands because the viruses can spread easily by hand touch. Washing hands and sanitization of hands. There are basically two ways to make sure our hands clean, which are washing hands using soap and use hand sanitizer to cleanse our hands. Hand washing. Hand washing use the soap as the medium. Hand washing needs to use the water to apply the soap. The soap must to apply to our hand, then scrub the soap for 20 seconds before rinse using water. For hand sanitizer, the hand sanitizer liquid as a medium, and it can be used without water. The way to use it is rubbing the hand sanitizer over both hands and let it dry. The importance of personal hygiene. There are three importance of personal hygiene. There are kills there are the personal hygiene can help to kill the germs and virus on our body. It also helps to prevent from spreading the viruses to other people. Lastly, personal hygiene can help to maintain the positive vibes vibes in our surrounding.
Okay, how do masks help stop the spread of the virus? Okay, first, the primary advantage of wearing a mask is to prevent the virus from spreading. If you are contaminated and wear a mask, the mask largely blocks certain droplets as you speak or cough from coming into contact with other people. The wearer can also be covered by mask. That's because the chance of becoming infected or how serious the disease might be is affected by the amount of virus you are exposed to. If you are wearing a mask and around someone who is infected, fewer droplets will get through your own mask. Okay, next. Is there any scientific proof that masks prevent COVID-19 infection? Okay, the answer is yes. The World Health Organization has sponsored one of the most well-known research. The study published in a major medical journal compared possible infection rates with COVID-19 with a mask versus no mask. Face masks have decreased the chances of infection by over 80%. The risk of infection was 3.1% with face mask compared with 17.4% without a face mask. A more recent study found that the number of infections and consequently the number of deaths may be substantially decreased by even a crude cloth covering that is less than 100% safe against the virus. And a study of other respiratory viruses, including influenza and common cold viruses, found that masks stop infected droplets from spreading while masks were worn. Okay. What are the best types of masks? The non-vented N95 respirator you see on many frontline health workers was the most powerful check. But to get the defense, you do not need to wear a N95. Choose varieties with several fabric layers if you and your family are wearing cloth masks. Masks that fit the face a bit tighter are a good choice as there are no gaps to escape the virus. Masks over the nose bridge with a moldable piece can help shape the mask for a better fit to the face. They will also help prevent the glasses from fogging up. Okay, that's all from me. Thank you.
Another way to prevent the coronavirus from spreading is by social distancing. What is social distancing? Social distancing, also called physical distancing, means keeping a safe space between yourself and other people. Stay at least 6 feet from other people who are not from your household in both indoor and outdoor spaces. Why practice social distancing? COVID-19 spreads mainly among people who are in close contact for a prolonged period. Spread happens when an infected person coughs, sneezes, or talks, and droplets from their mouth or nose are launched into the air and land in the mouth or noses of people nearby. The droplets can also be inhaled into the lungs. Studies indicate that people who are infected but do not have symptoms likely also play a role in the spread of COVID-19. This is an example on how to social distancing. This infographic shows that why social distancing is important. It can be seen that if the infected person has less contact with other people, the less people will get infected. Here are some tips for social distancing. Firstly, is by following the standard operating procedure or SOP. For example, like wearing a mask,
and use hand sanitizer. Secondly, we must consider social distancing options to travel safely when running errands or commuting to and from work. Only visit stores selling household essentials in person when you absolutely need to. And lastly, keep distance at events and gatherings. This is some more examples on what to avoid and how to maintain your distance.
Effect of COVID-19 to the mental health. What is mental health? Mental health includes the stable of emotion, psychology, and social well-being. It affects how people think, feel, and act. It also related to how people handle stress, interact with others, and how people make decisions. During COVID-19 pandemic, mental health is one of the most important points that must be taken seriously. It because many people are struggling with mental health problems in order to apply the new norm. What is mental health problems? There are three problems that started during pandemic COVID-19, during movement control order, during quarantine period, and during treatment. During movement control order (MCO), in general, MCO may not a problem for them who stay with family or friends, but for people who isolated alone, it may cause situations like stress, loneliness, and depression. It also affects daily routine such as sleeping or eating. During quarantine period, quarantine period is one of the hard times that must be faced by people who come from risky places, usually from abroad. They must do the COVID-19 test and self-quarantine in 14 days. During that time, the emotion and psychology of the person will be affected, usually because of they feeling worried about the test result, whether it is positive or negative. During treatment, many of the patients of COVID-19 having the mental health problem during treatment. The impact for their psychology can include anxiety, feeling angry, and stress. The daily death reported also can make them feeling worried, scared, and lost their hope. The solution for the mental health problem that stated are three. There is there are psychotherapy, support group, and medication. Psychotherapy is a treatment of mental problem provided by psychotherapists. It explores the feeling, thoughts, action, and also find the solution to improve the patient's well-being. Support group. Support group a group meeting when the group members will share the problems and also find the solutions together. They also share the goals of recovery and support each other. Medication. This solution usually for the patient that has been diagnosed. The patients that have given the prescription must follow the instruction for the best result. The medication will help the patients to manage the symptoms and promote the recovery.
So now I'm going to explain the effect of COVID-19 to people. So the most obvious effect of COVID-19 to people is death. Since this virus is a respiratory infection, the main cause of death is usually respiratory failure, but the virus can also damage the heart, kidneys, intestines, and liver. Let's see how it can affect those organs. This is the step by step on how the coronavirus can kill people. So, research shows that our immune response that protect our bodies from infection can cause some cases go from mild to critical condition. Here are the steps on how this virus can kill patients. The first step is the spiky proteins of the virus latch onto cell receptors called ACE2 located in the body. It begins in the lungs by binding to ACE2 receptors. Then the immune system senses a threat and responds by activating white blood cells, where leukocytes and neutrophils, which is two types of white blood cells, increase, and a decrease in lymphocytes, which is another type of white blood cell, among the critical ill patients. The third step is too many cytokinesis are released by white blood cells, proteins that stimulate the immune response further and cause inflammation in the body. Among serious and critically ill patients, Wuhan researchers found elevated levels of a main cytokine called interleukin 6 or IL-6. Next, the cytokine storm causes healthy lung tissue to destroy white blood cells. The reaction may lead to serious symptoms such as blood clots, severe blood vessel leakage, fluid in the lungs, blood oxygen depletion, and low blood pressure. In serious and critically ill patients, Wuhan researchers have found exceptionally high levels of D-dimer, which is a protein fragment that suggests the existence of blood clots. The fifth step is the lungs, heart, kidneys, bowels, and liver may be harmed by an active immune response. In serious and critically ill patients, Wuhan researchers found elevated levels of two proteins that can signal a heart attack: highly responsive troponin 1 and C reactive proteins. These individuals have had reduced albumin levels, a sign of problems with the kidney or liver. The last step is a membrane around the alveoli, which is a tiny air sacs in the lungs, is formed by proteins and dead cells, making oxygen difficult to absorb. This can contribute to acute respiratory distress syndrome, which is ARDS, a lung injury that is life-threatening. So that is all from me.